everyone, and thank you for joining today's webinar with Cancer Support Community Los Angeles. I'm Abby Espinosa, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled Radiation Therapy, the Process, Side Effects, and Support. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but we'll answer as many as possible. And now to introduce today's speaker, radiation oncologist April Vassantachart knows that it is a privilege to support and guide patients through their cancer journey. As a physician, Dr. Vassantachart believes that her relationship with her patients require a social connection that involves listening and learning on both ends to produce an individualized plan that meets the unique needs of each patient. The ability to combine her knowledge of physics and technology with medicine to provide precise, non-invasive oncologic care is what inspired Dr. Vassantachart to become a radiation oncologist. She has published an article in the International Journal of Radiation Oncology, Biology, and Physics that evaluates the effects of health literacy on understanding radiation therapy with the goal of improving shared decision-making with diverse populations. Dr. Vassantachart has also written a book chapter on the treatment of brain metastases in intracranial stereotactic radiosurgery. She has a passion for treating breast cancer, gynecologic cancers, and central nervous system cancers, among others, and has published numerous manuscripts depicting current trends of care, consensus recommendations, and the application of artificial intelligence in cancer care. In her free time, Dr. Vassantachart's hobbies include cultivating exotic houseplants, playing pickleball, hiking the California mountain ranges, and exploring the food scene in Los Angeles. It gives me great pleasure to welcome today's speaker, Dr. April Vassantachart.
Great. Thank you so much for that introduction, Abby. It's really a privilege for me to be here, and the cancer support community is such a great resource for all of our patients, and we really appreciate all the effort that's placed into providing these educational webinars and the support that is offered. So when you have a cancer diagnosis, it can be extremely overwhelming to go through all of the steps and hear about many different treatment options. So the goal of this webinar today is to give you an overview of what radiation oncology is, talk a little bit more about the process of radiation treatment, the reason for treatment, some of the potential side effects, and how can we support those around us that are going through the treatment together. So if you can all see my screen, then I'll go ahead and start the presentation. So just introduction, I'm a Southern California native. I completed my medical school training at Loma Linda University, then moved on to my radiation oncology residency at USC. And now I am currently a clinical assistant professor of radiation oncology with City of Hope. And I am a provider at Providence St. John's Health Center in Santa Monica, as well as City of Hope, Sherman Oaks. Okay, so the overview of our objectives today is we are going to discuss why do you need radiation treatment and why do we give it, what to expect during the radiation treatment process, and how to support those undergoing treatment. So first of all, the steps of cancer treatment, in general, it involves a combination of chemotherapy, surgery, and radiation. You'll often hear a lot of terms such as neoadjuvant treatment, primary treatment, and adjuvant treatment. And this is a diagram that helps you to understand why there are these different steps within the treatment. So in general, neoadjuvant treatment, it discusses treatment that's prior to the primary therapy. The primary therapy is the main treatment where you're either getting surgery or definitive doses, high doses of radiation to kill off the bulk of the tumor cells. And then adjuvant therapy is after the primary surgery or radiation treatment. It's additional medications or radiation that can kill any type of microscopic residual disease. So in this diagram here, you can see with neoadjuvant treatment, the goal really is to shrink down the tumor. So if the tumor is initially large, like the circle here, then with neoadjuvant treatment, you can shrink the tumor down to a smaller area so that surgery or the primary modality, which can also be radiation, can be more feasible. And after that is when the adjuvant therapy comes in to eliminate any residual tumor cells. So what is radiation therapy? Oftentimes when you think of cancer care, a lot of people have heard of chemotherapy and surgery, but radiation therapy is actually a very effective treatment modality that can kill tumor cells. And the way that radiation kills tumor cells is that it uses high energy particles and waves, and that's used to destroy and damage the cancer cells. So this is a diagram looking at different types of wavelengths and different types of radiation, but in general, with very large radio waves, these are very large waves that are the size of buildings. As you get smaller, the energy of the radioactive wave, it gets higher in energy. And with radiation treatment, we actually use gamma rays here, and that's when the wavelength is small and the size of the atomic nuclei. So there are different types of radiation treatment. So in general, the main two types are internal radiation and external radiation. So internal radiation treatment is when radioactive seeds are actually placed inside of the tumor within the body, and the radiation starts from the inside and radiates outwards. For external beam radiation, the radiation comes from outside in, and then it really focuses down on the tumor, but it does enter from the outside. There's particle beam radiation, which involves either proton therapy or electron beam. And the most common type of radiation is photon beam radiation. And this can be given with different modalities. There's techniques called 3D radiation, IMRT radiation, SBRT and SRS radiation, which are stereotactic radiosurgery types of radiation where we're giving a very high dose all at once. And we'll go over into some of the details of this and the plans coming up in a few slides. So in general, the most common type of radiation is external beam radiation. And here's just some pictures of what to expect on what the rooms look like when you get your radiation treatment. So this is a picture of a halcyon machine. So the patient would lie down on this table here, and this table, which we call the couch, will move into the radiation beam that's given out from this circular ring. This is a different type of machine here, and this machine actually moves around the patient as the radiation treatment is going on. So there's different machine modalities, but in general, the radiation is high energy light that's focused right onto the tumor while the patient is lying down on the couch. Here's some examples of what radiation looks like from our standpoint when we're planning it for the treatments. This is a picture of a breast cancer treatment. So on the left breast here, this is the left side, things are flipped when we're looking at it on imaging, but this is the left breast here, and you can see there's two different beams that are coming from either angle, targeting the entire breast tissue and avoiding the heart, which is depicted here, and then trying to avoid as much lung as possible. Very focal radiation is also possible, and on the right side here, you can see that these are metastatic deposits actually from a primary cancer, and we can be very focal and radiate high doses to ablate tumor in a very small region. And this is what's called stereotactic radiosurgery. Other terms that you'll hear of are conventionally fractionated radiation therapy. And this is the most classic radiation that you hear of, where we give a small amount of radiation every day. And typically this occurs over the course of 3 to 6 weeks of treatment. The other more high intensity radiation treatments are called stereotactic body radiotherapy, SBRT, or stereotactic radiosurgery, which is SRS. And those are typically given within 1 to 5 treatments. We're giving a very high dose each day to a very limited area. Here's a picture of the internal radiation. Another term for that is called brachytherapy, which I discussed earlier. And this is when there's a tumor that is amenable to having very intense radiation within the organ. This is typically done for cervix cancer or prostate cancer, where we can actually place a device inside the cervix or the endometrium or the uterus and aim the radiation right on the spot where there's cancer. So you can see here, when you have devices that are able to give radiation to a very focal area instead of having radiation that comes from outside in, where you get low doses of radiation to other organs. You can actually be very precise and give radiation only to a small area around the region of interest. These are just other pictures showing this small area where you can really give a high dose of radiation to minimize side effects to normal tissue. Okay, so how does radiation actually kill cancer cells? So this high energy light, it's from outside in, it comes in and it affects the cell by breaking DNA. So when this high energy light touches the DNA, it can cause strand breakage. And what we're looking for is actually double strand breaks of the DNA. So radiation does cause damage to both cancer cells and normal cells, and it can cause double strand breakage in both types of cells. With cancer cells, they have mechanisms that are not as good at repairing these double strand breakage, and this is how we get a differential killage of the cancer cells compared to the normal tissue cells. So with normal tissue cells, there's mechanisms that can repair these double strand breakage and actually prevent a lot of the toxicity that's going on to the cancer cells. So it's really this difference that allows us to target the cancer cells specifically while avoiding as much radiation and normal tissue side effects. Okay, so just off the back, I know that was a lot of information up front. If there's any questions, then feel free to ask now, but we'll also move on to going over the process of the radiation treatment and go a little more details of what to expect during the radiation treatment. I can't see the Q&A box on my end at the moment. So Abby, if there's any questions, let me know, but if not, I'll move forward now.
We currently don't have any questions, but I will let you know.
Great, we'll go forward. Okay, so what is the process of radiation treatment? So there's 4 main steps once you start undergoing the referral to a radiation oncologist. So the first step is the consultation, and this is the moment where you speak with your radiation oncologist, you discuss the treatment, and you go over a lot of the details of what to expect during the treatment. After that is the CT simulation, and this is the planning scan that's used to establish the setup for the daily treatments. And then there's a planning time where there's a whole team behind the actual radiation plan that makes sure that the treatment is very precise and safe for your actual treatment. And then there's the initiation of the radiation therapy. This is typically 3 to 6 weeks of treatment. And in certain scenarios, the treatment can be completed in 1 to 5 treatments, but really in general, it's typically about a 5-week process. And this is because we're giving small amounts of radiation each day. So going into a little further detail on the consultation process. So what to expect during this visit is your radiation oncologist will go over your history and talk to you about your current cancer diagnosis and the goals of the radiation treatment in terms of, are we doing treatment before surgery? Is this the primary treatment where we're really giving the radiation to kill all the cancer cells? Or is this the adjuvant treatment where we're trying to clean up any type of residual cells that may be surrounding the tumor cavity or potentially microscopic disease that could be in the lymph nodes? So what is important information to disclose to your radiation oncologist? A very important factor is, have you had a history of prior radiation? So your body remembers the radiation that it's received, and it's very important if you've had prior treatment with radiation to make sure your radiation oncologist knows. We're able to tailor our doses and really see what's feasible in terms of balancing side effects and cell kill when we know the full complete history of what type of radiation you've had in the past. It's also important to disclose to your radiation oncologist if you have a pacemaker or an implantable device. If you have a pacemaker that's in close proximity to the area that's receiving radiation treatment, then we actually get clearance from your cardiologist. There might be additional devices that we use to ensure that there's no damage or potentially setting off a pacemaker during the treatment. Other important information to disclose is if you have any connective tissue disorders, such as scleroderma, or a germline mutation that predisposes you to cancer, such as a BRCA mutation or neurofibromatosis. All these come into the treatment decision for radiation treatment. Your radiation oncologist will also be asking you all of these questions, but these are common and important information that you will be disclosing to your radiation oncologist. Another question is, what do you ask during your radiation treatment? It's a lot of information coming at you at once. So sometimes it's most helpful to actually have a notepad that has a list of questions so that you're not overwhelmed during the consultation and you can actually go through some of these additional questions. But common questions that are important to ask is, what is the benefit of radiation? And your radiation oncologist, depending on the cancer site that's being treated, is going to give you a lot of details in terms of why is the radiation necessary? Is this improving my survival? Is it improving rates of local recurrence? What's the risk factor that something will come back with and without radiation? Another important question to ask are, how many treatments are needed? Oftentimes, this spans a course of about 5 weeks of treatment, and having a set plan of when you'll need to be coming daily for your radiation treatment is important. We try to avoid missing treatments as much as possible during radiation, as you get the best effects when you're doing daily radiation Monday through Friday without a lot of treatment breaks. There are some cancers that are more sensitive to these treatment breaks than others, and your radiation oncologist will disclose this to you. Other questions to ask are, what are the short and long-term side effects? These side effects are very dependent on the area that's being treated and the type of cancer that you had. There's different doses that we give. There's different areas that are receiving radiation. So your radiation oncologist will go in a lot of details in terms of the short and long-term side effects. And another question to ask is, are there any techniques that can be used to decrease radiation to my normal organs? This is something that is, again, very dependent on the area being treated, but there's a lot of new techniques that we'll go over in a couple slides as well that can actually reduce radiation and reduce side effects. Okay, so common questions. So some of the most common questions that I have my patients ask are, will I be radioactive during treatment? And the answer to this is, for external beam radiation, you are not radioactive. The moment the machine is turned off, there's no radiation left over in your body. And actually eating a banana would have more radioactivity inside your body compared to actually getting the radiation treatment. So you are definitely safe to be around people and children. If you are getting an internal implantable radiation where there's a seed that's left inside your body, then there can be some differences in terms of radioactivity, and this is something that you discuss with your radiation oncologist. But in general, if you're getting external beam radiation or even implantable devices where the seeds go in and then come out, then you're not radioactive at all, and you're completely safe to be around others. Another common question that's typically asked is, what can I do during radiation to make the treatment more effective? And there's no specific guideline in terms of diet or exercise activities that can make radiation more effective. The most important thing actually is on your CT simulation, which we'll talk about later, to try to keep that CT simulation as similar throughout the entire treatment. And things that can help with that are having a full bladder, empty rectum, and we'll go over that a little more in a couple slides. Next question is, what can I do during radiation to prevent side effects? So there are, depending on the side effects that are potential for your treatment, a common side effect is for breast cancer of having skin reaction. So there's different creams and lotions that we can use to apply to your skin to prevent redness of the skin. And there's a number of different other options depending on the treatment site. But in general, using lotion or a moisturizer of your skin is very important and effective at preventing redness of the skin. Another common question is, will I lose my hair? And with radiation treatment, the only area that's getting side effects is the area being targeted. So if you're getting breast radiation, you will not lose any hair off of your head. If you're getting prostate radiation, there's going to be no changes to your hair on the top of your head. If you are getting brain-directed radiation, there can be some areas that there can be some hair that falls out, and that really depends on how close the radiation is to your hair follicles. So again, it's a nuanced discussion that you'll have with your radiation oncologist, but in general, if you're getting treatment below the neck, there's going to be no loss of any of the head on your hair. And how long will each session of radiation be is another common question. Typically, you're in the radiation department for about 20 minutes. Each session is actually very quick. The radiation time that the beam is on is typically around 5 to 10 minutes. And the sessions tend to be very quick. You don't feel anything. There's no pain during the radiation treatment. Another common question is, can I take my medications and supplements during radiation? Taking medications is completely fine. You can review your list of medications with your radiation oncologist. In terms of supplements, we do recommend avoiding antioxidants. Normal antioxidants in your diet is completely fine to take, but if you're taking high doses of supplemental antioxidants, it could potentially make the radiation slightly less effective. Radiation actually causes oxidation, and that's how it damages DNA. So if you're taking too many antioxidants, it could potentially decrease the efficacy, and so we try to avoid that during radiation. So this is an example of the next step after the consult, which is the CT simulation. And this is the step where you'll come in for what's called the radiation planning scan. So during the CT simulation scan, you'll lie down and we place you in the exact same position that you'll be in for the planning scan, as well as each of your radiation treatments. So on this scan, it's actually the most important that you are very comfortable during this treatment planning scan, because you'll be in the same position for the rest of the treatment. There's different positioning that'll be used depending on the area that's being treated. Typically, you have your arms down or versus having your arms up if you're treating the breast. And this is also the planning scan where we'll talk to you about different techniques to avoid radiation to your normal organs. For breast treatment, that could be a breath hold technique where you actually take a deep breath in, and that moves the breast tissue further away from the heart and can actually decrease the percentage of your lungs that are getting radiation. Other techniques during the CT simulation process are having a full bladder or an empty rectum. When you have a full bladder, it moves bowel out of the way, or small bowel, your intestines out of the way, so that less of your intestines get radiation. If you have an empty rectum and have a bowel movement before your radiation treatment, this can move the rectum and that rectal wall further away from the area that's getting treatment if you're getting treatment to the endometrium or the prostate, and this can help to prevent side effects. So these are some of the devices that we use during the CT simulation. So here is what's called a vac lock, and it's a bag that makes sure that you're in that same position every day during treatment. This next picture here is an example of a mask. So if you're getting treated in the head or the neck, then we use a mask to make sure that your head is in the same orientation every day. There are little holes here so that you can breathe, and we try to make this experience as comfortable as possible. If you do have a history of claustrophobia or have a lot of anxiety about going through with this mask treatment, you can also talk to your radiation oncologist about it. There's medications we can give ahead of time to help make the process a little more smooth. There's even masks that have openings over the eyes that can make the mask more comfortable as well. During the CT simulation, we get a CT scan, and this is what you see here. And this is how we map out exactly where everything is in your body, so we can see the areas that need treatment and the areas that need to be blocked from treatment. Okay, so the next phase is the planning phase. So typically from the time of the CT simulation to the time when you actually start the radiation treatment, there's about a week time period where we go through the planning phase. So this involves a large treatment team. So the radiation oncologist will oversee the entire treatment plan, but we do have a number of other members of our treatment team, including a medical physicist, a dosimetrist who helps to form the plan, make sure the dose is going in the right areas, and then our radiation therapist staff. And the radiation therapists will actually be the people that the patients see on the daily basis, because they set the patient up on the treatment table to make sure they're in the exact same position each day. There's also our nursing staff, our front office staff, and all together we help to make sure that the process runs as smoothly as possible. So during this planning phase, you'll see here that this is a tumor that's centered here on the left side, and we aim the radiation dose, the high energy dose, right around where the tumor is, and we carve the low energy dose to be off the normal structures as much as possible. So here you can see this is the brainstem. This is a more sensitive area of the brain, and we're able to carve the high dose radiation right off of there, and also spare the eyes, the lenses, and the normal brain as much as possible. As you can see here, this is a very conformal technique, and this is used to really ablate the tumor in one area and prevent side effects to other organs. Over here on the right side, this is an example of a prostate radiation treatment where the high energy dose is going right to the prostate and really limited that high energy radiation to the rectum back here and to the bladder in the front. Okay, so what to expect on the actual treatment day? So this is a patient that's laying down on the treatment table, and this is the radiation machine that will move around the patient during the treatment, and it'll deposit radiation at different angles to really make that conformal plan. So the radiation therapist will align you to the same position as your CT simulation. Each session is approximately 20 minutes with the radiation treatment given in less than 10 minutes. So it's very quick. You don't feel anything again. There's no burning. There's no pain during the radiation treatment. And in general, each day you receive the same amount of radiation. So we plan out your entire course and then we fractionate the radiation out over that course of 3 to 5 weeks. So you're getting a little bit each day. That way we can kill those tumor cells and allow the rest of your normal tissues to recover. There are different websites that you can actually use to get used to the treatment facilities when you go through with your radiation consultation, or if you have further questions before you start your treatment, you can definitely tour the department that you are going to get the radiation treatment at. There's also a virtual reality 360 tour on YouTube that you can use with the Children's Hospital of Los Angeles. They actually have a video where you can use your mouse and move around the room to actually see the whole process and see the entire treatment room as it's going on. And there's a link here and you can search it up on YouTube as well. But this can be very comforting just to know what to expect during your treatment day. So these are some of the techniques we use during treatment to help to really move the radiation dose to only the areas that need treatment. So this is an example of infrared lights, and this is an advanced technique that is that's newer. In the past, we didn't have some of these techniques. So as the technology improves, we get even more and more conformal, and we're able to spare the normal tissue. So the radiation treatment in terms of toxicities has definitely been improving. So these are infrared lights that actually map out your body contour. And when you take a deep breath in, we're able to map out exactly where your chest wall is and give the radiation at that point. So this is an example of a breast treatment where we're treating here at the breast. And you can see there's a good separation between the heart, which is the organ here, and the actual treatment here on the breast. Without the breath hold technique, you can see the heart is much closer to the chest wall and the breast tissue. So with the breath hold technique, we're actually able to spare the heart much better. This is an example of a full and empty bladder. So with the full bladder, you're pushing bowel out of the way so that if we're treating something posteriorly here, there would be less toxicity to your normal organs in terms of bowel when you're doing a full empty bladder. In general, these are just some pictures of radiation treatment to get an idea of which areas are actually getting radiation and what the different techniques that you often hear about, what they look like. So on the left here, this is a 3D radiation technique where the angles of the beams are coming from 4 different angles. You can see there's relatively high dose that's going through 4 different areas and a box of high dose radiation here that's seen in the red. Now with a more advanced technique, oftentimes for definitive treatments, we are using techniques such as IMRT or VMAT treatment, where we're really targeting right to the tumor bed or the tumor that's present. So for this case, it's a prostate. The prostate is getting a high amount of radiation, and there's lower amounts of radiation going around to the other areas. And now this is even more advanced technique called VMAT technique, where there's very low radiation going to other areas of the body that's depicted in blue, but the higher dose radiation is very tight and conformal right around the prostate. This is also an example of the different types of brain radiation. So in the past, for brain metastases, so cancer that has spread from other organs into the brain, we used to target the entire brain. Now there's different techniques where we can spare the hippocampus if there's no tumors close to the hippocampus, and this helps to prevent neurocognitive or memory changes in the long term. And if you only have a couple or a few metastases in the brain, there's actually very local techniques that we can use now where we really ablate only the area in the brain that has a tumor, and this helps to prevent side effects of radiation to the entire brain where you can have some memory difficulties. So the treatments can be very precise, and it has very high success rates actually of killing tumor cells, even small tumors within the brain. This is an example here of radiation to the lung, where we're being, again, very targeted right to the tumor in the lung, again, with very high success rates in terms of local control of ablating tumors. And if you're not an operable candidate for surgery, then oftentimes radiation is a very good option to ablate tumors in the lung as well. And now we're moving on to newer techniques where we even target metastatic disease with high doses of radiation to ablate them, so that you can see here, there is tumor, and then after a high dose of radiation on the subsequent scans, the tumor can actually be not active anymore. Okay, so in general, what are diet and activity restrictions during treatment? So there are no specific dietary restrictions. Because we want each treatment, your positioning to be very similar, we do aim for trying to maintain the same weight throughout treatment. So a standard balanced diet is appropriate. Again, avoiding supplements high in antioxidants during treatment can help to prevent any detriment to the efficacy of the radiation treatment. And if you have further questions, a nutrition consult can also be added for further information on dietary needs. There's specific treatments, for example, to the head and neck, where we're radiating a large portion of the mouth and the throat, where more intensive dietary needs are discussed, and we really aim to try to improve and keep up your appetite during some of those treatments. In terms of daily activities, what can be done to help improve energy during radiation? So fatigue from radiation builds during the radiation treatment. Typically on the first treatment, you don't feel much fatigue, but over the next few weeks, you can feel more tired during the day. And a nap after treatment or in the evening often helps patients to improve their energy levels during the rest of the treatment. And depending on the treatment site, avoiding sun exposure can help prevent darkening of the skin or worsening of skin side effects, but not all radiation treatment gives you a lot of skin side effects. So this is something to discuss with your radiation oncologist. Okay. In terms of side effects, there's really a large range of side effects depending on the tumor type that's being treated and the goals of the treatment. So this is something that you'll discuss in detail with your radiation oncologist during the consultation process. Again, as a general overview, the radiation is very targeted and it does not affect the whole body. So we aim it at specific areas of the body, and these are the only areas that get radiation. The radiation doesn't go into your bloodstream for these external or internal radiation treatments, and it doesn't go throughout the body. It's really focused onto the area that's being targeted. So the side effects are limited to the organs near the regions being treated. So in general, common side effects. So for breast cancer, if you're getting treatment to the whole breast, there can be fatigue, there can be skin redness and peeling, and those are the most common side effects you'll see during treatment. There's other more rare side effects such as potentially cough or in the long term having thickening of the skin that can happen as well. For prostate cancer in general, fatigue, having diarrhea, increased urinary irritation or frequency can be seen as well. For lung cancer, because it's near the lungs and potentially near the esophagus, you can have a cough, potentially some discomfort with swallowing, depending on the region that's being treated. For head and neck cancers, since you're treating near the oral cavity, the mouth, and the neck, then there can be potentially mouth sores and a lot of pain with swallowing as well as weight loss. Head and neck treatment tends to be a treatment that has more side effects because the mucosal area in the mouth and the neck is very sensitive to radiation treatment. So each of these areas getting treatment, your radiation oncologist will really go over a lot of the specific side effects and techniques that we can use to decrease the radiation side effects, or different medications that we can use to alleviate pain or symptoms in those areas. For the long-term side effects, this again depends on the location of the treatment. Potentially for treating near the bowel or near the bladder, you could have increased bowel movements, nausea, urinary frequency. If you're treating near the heart, for example, a lung cancer that a part of the heart will be getting radiation, there can be increased risks of heart disease. So these are very important treatment discussions that you'll have with your radiation oncologist. It's possible to get a cough with different techniques of radiation. Typically, these are self-resolved with just a short course of steroids. A very rare long-term side effect that we often get questions about is, what are my risks of cancer from radiation? And there is a very rare risk of having cancer after having radiation treatment. Typically, that risk is less than 1 in 1,000 people. If you're younger, that rate can be higher. With the radiation secondary malignancies, they typically occur 20 to 30 years after your primary radiation treatment. It's the highest likelihood is if you're getting treatment at a very young age, that there could be this risk of cancer from radiation. Oftentimes when we're adding radiation, the benefits radiation far outweigh this rare side effect, but it's an important discussion to have with your radiation oncologist. Okay, so what happens after the radiation treatment is done? So after radiation treatment is done, the side effects actually peak 1 week after treatment is over. So radiation, it continues to work on the tumor cells even after the radiation is done. So many months after the radiation is done, because the radiation is breaking DNA in cells, this breakage of the DNA actually can cause the cells to die, much later than the actual timing of the radiation treatment. So the full effects of the radiation is not done until actually quite a few months after radiation treatment is done. So in general, you'll have a follow-up with your radiation oncologist about 2 to 4 weeks after completing treatment. And this is to go over your side effects, see how you've been improving and recovering, and to answer any questions that you might have. And depending on your cancer diagnosis, follow-up with your oncology team will be approximately every 3 to 6 months. And again, depending on the treatment site, you might need lab tests or imaging tests during these follow-up appointments. Of course, if you're having anything that's concerning or any problems outside of these follow-up appointments, it's very important to talk to your radiation oncologist or your oncologist to make a follow-up so that someone can help you and manage side effects or manage any of the questions that come up. Okay, then another question that I often have is, it really takes a team to treat cancer. And a question that I have a lot of times from family members or friends of patients that are undergoing treatment are, my family member or friend is undergoing treatment. What can I do to help? So, it's a very tough time for both patients and families. So being a listening ear is very important. Sometimes the patient themselves are very overwhelmed with the treatment process. So having someone to assist them and connecting them to a support group can also be very useful. There's very specific support groups depending on the type of cancer that a patient has, their age range. There's youth and young adult support groups, there's elderly support groups, and really honing in and finding a group that you can relate to can be very helpful. And hearing about other people's experiences, the tips that they may have for you as you undergo treatment, it tends to be very reassuring and helpful to patients. So another thing you can do as a family member or friend is really understanding the side effects that your family member might be going through. Commonly, they're going through fatigue, skin irritation, nausea, or pain. If you're aware of some of these side effects, then it can help you as you discuss daily activities, or maybe you can assist with daily chores. It might be more difficult to create balanced, planned meals for the patients. And discussing this with a nutritionist and being able to assist in some of these smaller features can really help to support your family member going through the treatment process. So other resources that are available is that we really have strong support within the hospitals to assist with many different aspects of the treatment care. So the radiation, chemotherapy, and surgery, that's really just one component of the treatment. Having a full range of support is very important. So there's often a social worker that you can consult, and the social worker can discuss additional resources there that are available. For radiation treatment, typically it's involving many weeks of radiation treatment, and there can be hardships such as transportation, making sure you have time off work. There's social workers that can help to make sure that we can make this as convenient as possible for you. There's different assistance programs in terms of getting ride shares, Ubers, financial support so that you can come to your radiation treatments as well. There's different resources for mental health and financial assistance. And again, the social workers also know of a wide range of support groups, and they might be able to find some support groups that are very specific and tailored for depending on the type of treatment that you're undergoing. Again, nutrition consults can be very, very helpful, particularly for head and neck cancers or cancers where we're treating the esophagus or stomach, where nutrition becomes a very important component of the radiation treatment to maintain your weight, and also just to create a balanced diet so that your energy is maintained during all these treatments. The physical therapy consult is also can be very important, particularly for breast treatment or when we're treating lymph nodes in the arm. Physical therapy can help to make sure that the mobility of the patient is very strong. They're maintaining flexibility. It can prevent edema in the arms or legs. So this physical therapy consult can be very important, and it's something that you can ask about if you haven't been referred already. And there's also psycho-oncology, and these are specialists that are trained in talking about mental health and adjustment during the hardships of going through cancer care, and having a specialized psycho-oncologist that understands both cancer and mental health can be very useful and important in these settings. But that's my general overview for radiation treatment. I wanted to make sure to leave time for any questions, as I know that the radiation process, on top of the rest of the cancer care situation, can be very overwhelming. And oftentimes radiation is one of the more mystical types of treatment that patients don't hear about a lot, especially because you don't see any of the radiation side effects. It's not like surgery where you can see a tumor being carved out. The radiation is an invisible high energy light source, but oftentimes the radiation side effects are relatively minimal, and it's very effective at killing this cancer and DNA cells and DNA within cells. I see actually a chat option. If there's any questions, then feel free to ask now. Abby, I believe there might have been a few questions that came in before the webinar started as well.
Yes, so we did get a few in our Q&A box. I can go ahead and read them to you. So someone asked, is there any way to prevent the long-term side effects of radiation therapy by taking supplements?
Yeah, so it really depends on the area that's being treated. In general, we don't have an end-all cure-all for long-term side effects for radiation treatment. So there's examples of if you're getting treatment to your breast, and a long-term side effect potentially is having fibrosis of the breast tissue. There's actually a lot of research going on into genetic profiles to figure out who are the patients that get these longer-term toxicities. A supplement that if you are taking it already, like vitamin E, it potentially can be helpful, but right now we actually don't know of a cure in terms of eradicating these long-term side effects. Things that are the most important in general is having a healthy, balanced diet, doing exercise daily, and it depends on the area being treated, but if you're getting treated to the breast, that fibrosis or stiffening of the arm, you can prevent it by actually doing arm exercises and really stretching out the arm, doing physical therapy, ensuring that you have adequate motion of the arm, and that actually helps prevent the side effect from starting to begin with. Depending on the treatment site for endometrial cancer, cervical cancers, there's dilators that we can use to prevent vaginal stenosis, or it really depends on the treatment site, but there are a lot of different mechanisms. We try to prevent the side effects from coming on versus trying to get rid of them once they do come on. So discussing that up front with your radiation oncologist is very important.
Thank you. And someone else asked, how soon after completing radiation for breast cancer can one have a PET scan? How do we know if it worked?
So for breast cancer in general, so the radiation for breast cancer is given after the surgery. So breast cancer, you could potentially have chemo first, and then you get surgery, and that's when the radiation comes in. When you have surgery for breast cancer, you're actually taking out all the disease that's seen on a PET scan or typically a mammogram or MRI. So as far as we can see on imaging, there's actually no tumor that's left over in your body. So what radiation is doing is that when you have a primary cancer disease, there can be small bits of tumor that's around the primary tumor site, and that's what radiation is coming in and killing. So you actually can't see anything on images to ensure that those tumor cells are gone. It's an adjuvant treatment that's used to kind of clean up and make sure that nothing's coming back. In general, for breast cancer, if you just had surgery alone, the rate of something coming back is along the lines of 20 to 30%. When you add radiation to kill this microscopic disease, it decreases that rate by 50 or 75%. So, after radiation, your risk of recurrence is along the lines of 7 to 10% in general. For the images that you do after treatment, typically for breast cancer, it's actually just mammograms that you would get usually about 6 weeks after your surgery, and then annually after that, as long as there's nothing suspicious. But the imaging actually wouldn't pick up the microscopic disease that the radiation is killing. The images would be to find if there's a new lesion that comes up, then that's what the images is going to catch. So all of these are a little different. There's some treatments where we're treating an actual tumor that hasn't had surgery. And typically, if we're doing definitive radiation or definitive chemoradiation, we actually wait about 3 months after the radiation to do the next PET scan or the next surveillance scan. It takes radiation actually about 3 months to have the complete effect. Even after 3 months, there's still more effect of the radiation, but typically we're seeing the full effect by 3 months, and that 3-month scan after the radiation is going to show us, is there any activity left in the tumor? Radiation also doesn't always completely remove the tumor. What it does is it makes sure that it's not alive anymore so that the tumor cells can't repopulate. Cancer is a problem because it continues to repopulate and grow and grow. The more it grows, the more problems it creates in that area, and also has the potential to spread. So if you're killing the tumor cells there, and as long as they're not active, then that's when it's no longer cancer in that area. So typically for definitive treatment, when you're not undergoing a surgery, that's when that PET scan at 3 months is very important.
Thank you. And then someone asked, why do some people only get a mild sunburn while others get open wounds?
Yeah, that's a very good question. So there's a lot of different techniques for breast cancer radiation or treatment near the skin. So if you have a skin cancer and we're treating all the way up to the skin, and we actually want to see that there's a brisk reaction at the skin because we want to kill the tumor cells that could be at the skin. For breast treatment, when you're not as concerned about skin cancer, because you're concerned about more of the mammary tissue within the breast, then the goal is to get the radiation up to close to the skin, because the mammary tissue does go very close to the skin surface, but we're not actually targeting the skin. So in those cases, there's different methods that everyone's body is a little bit different, but usually if you're proactive with starting the creams early and escalating creams as necessary, you can avoid a lot of the brisk reaction. There's also different scenarios where if you've had a mastectomy and there's concern for skin involvement or positive margins, where your radiation oncologist will actually place a bolus, which is a thin amount of pseudo tissue, and that actually helps to bring the radiation dose up to the skin. So if there's concerns for skin metastases or skin involvement, then oftentimes your radiation oncologist is actually trying to get more of that brisk reaction to kill cancer cells that could be within the skin. So it's really a case-by-case basis in terms of what the goal of the radiation treatment is, and that can lead to worse or better side effects. So in general, it depends on really the goals of the treatment. Some patients, if we aren't targeting the skin, this is a general breast cancer treatment, there is actually a lot of variability in what we see in terms of skin reaction. Things that tend to, for patients that tend to have more skin reaction than others, skin tone is not necessarily correlated with that. Patients that have had a lot of skin damage in the past, for example, a history of a lot of sun tanning when they're younger, I've seen that they tend to have a higher skin reaction. But this is actually another research question that's undergoing right now in terms of trying to find within your genetics or your tumor analyses which patients actually have more of these brisk reactions. The most important step is really starting moisturizing cream from day one of the treatment. Calendula cream is a very good cream that helps to prevent irritation. And, again, once you start seeing redness, talk to your radiation oncologist, because we can add additional creams onto that to reduce the skin side effects even further. There's actually even newer creams now that are using silicone-based components. One of them is called Strata XRT, and it's been very effective actually in preventing skin redness. We typically use that the most for head and neck cancer patients because they get a much higher dose than breast cancer, but it is an option for all cancer patients, especially when we're treating close to the skin. And these are different creams that are available that you can ask your radiation oncologist about as well.
Thank you so much. And someone asked, is it true that radiation continues to work after finishing the daily radiation cycles? And for how long does it continue to kill the microscopic cancer after finishing external beam radiation?
Yeah, so that is true. So with radiation, since we're killing DNA within cells, the cell actually it starts to die and starts to have problems when it tries to regenerate with this DNA breakage. because of that, not all cells are, making a new cell right away. So as time goes on, when it's trying to regenerate and make that new cell, that's when a lot of the cell kill occurs. So in general, most of the cell kill is happening in the first 3 months. It actually extends beyond that. So that's why we get that PET scan at 3 months afterwards. You can actually continue to see responses after that. An example of this is in anal cancer, where in the past, people tried to see when is the best time to know that the treatment actually failed. And they found that if you go to 6 months out, the tumor can continue to respond and actually completely regress at 6 months and even further beyond that. So it does take time for radiation to continue to work, and side effects peak 1 week after, and then they actually get better. But even when the side effects are getting better, the cell kill and the benefits of radiation are actually still going on, typically about a 3 to 6 month range.
Thank you. And someone asked, for breast radiation, is it better to lay facing down with breast tissue hanging or facing up to avoid radiation to the lungs?
Yeah, that's a very good question. So there are lots of new techniques for breast radiation treatment, and depending on where the lumpectomy cavity is for your breast treatment, you can discuss with the radiation oncologist both options. So there's even a form of radiation called partial breast radiation if you're a very early stage breast cancer patient, where we only target the tumor bed and about a 2 centimeter region around the tumor bed. And that can prevent side effects to different areas too. But if you have a cavity that's not in the inner quadrant, so not closer to the sternum, or it's closer to the nipple, then lying in the prone position can actually move that breast tissue away from the heart and lungs so that you can aim the radiation beams as even further away from the heart and lungs. So that's one technique. With breath hold technique, that typically does a similar effect where you're moving the breast tissue away from the heart and lungs. If you have more pendulous breasts, then the prone technique where you're lying on your stomach, it can be more beneficial. So everyone's anatomy is a little bit different, but there's definitely patients that benefit a lot from the prone breast technique, and this is a technique that you can discuss with your radiation oncologist.
Thank you. And someone asked, is it critical to choose a facility which has the latest technology?
Mhm. So yeah, so the tough part about radiation is that you do have to come in usually every day for 3 to 6 weeks, and that is a big, constraint in terms of finances, transportation. It really depends on the technique that's needed for your specific cancer. In general, having a facility that communicates well with your surgeon or your oncologist is important. So as long as they're in good communication and there's a relatively standard technique procedure that can be done, then it's okay to go to a facility that's closer to you. For breast cancer treatment in general, the fields that we use for breast cancer are a bit wider because we're treating the whole breast, and we're actually not doing those fancy techniques where we shoot from many different angles because we don't want to shoot from the front. We only want to shoot the beams from either side of the breast. So with breast treatment, it's relatively a similar process as long as they have techniques such as prone if you need it, or breath hold techniques. So it doesn't hurt to get a consultation with where you got the surgery with a radiation oncologist, and you can actually ask your radiation oncologist, do you think that treatment at whichever facility that you're thinking about that's more convenient, if it's appropriate or not. In terms of treatments that benefit from having a newer treatment machine, that's when we're typically talking about SBRT or SRS, where it's stereotactic ablative radiation, where we're giving a high dose of radiation to a very small area. Typically that's done for metastatic disease or for a very focal area that needs ablative radiation, such as a lung cancer. In those situations, having a newer technology machine can be better in terms of making sure that dose is very conformal. So in general, there's a very wide range of different treatment machines, and it's a case-by-case basis in terms of which one's the most effective. In general, though, if you're getting treatment in 1 to 5 treatments, that's when there's going to be more benefit of having a newer machine with some of these higher techniques. Because we're giving such high dose at once, it has to be very conformal and a very tight plan so that you're giving a large amount of radiation to the tumor and then sparing the normal tissue around it.
Okay, thank you so much. I believe that is the last question we have time for. Thank you so much for sharing your expertise, Dr. Vassantachart. We really appreciate you being here today and sharing all of this knowledge with us. So I will be sharing just one final slide. Um, I can go ahead and share right now. So if you would like to learn more about Cancer Support Community Los Angeles, you can go ahead and visit our website at cancersupportla.org. And if you have any questions about today's presentation or about any of our programming, please feel free to email us at info@cancersupportla.org. We also have one of our flyers here, and it shows all of the wonderful things that we offer, free at no cost. And like Dr. Vassantachart mentioned in her presentation, one thing that would be great would be to join support groups. So if you would like to look at the full list of the support groups that we offer, you can go ahead and visit our website as well. And if you have any questions or have any trouble with joining any of our programming, please feel free to email us at info@cancersupportla.org. We also will be sending a survey. You will be receiving that once this webinar concludes today, and you will also be receiving a follow-up email tomorrow after the webinar. And once again, I just want to thank Dr. Vassantachart. We really enjoyed the presentation, and we're really honored to have you here today. And I'd also like to thank our participants for joining today and being engaged with all of us. We really enjoy having you all here. And I hope to see you all at the next webinar. Thank you. Bye.